Imagine hearing your child wheeze and struggle to breathe with every breath they take. Imagine your infant doing this. Imagine having to place this cannula on your child every day, taken away from their pretty little faces. This was my reality when my daughter was diagnosed at a month old with laryngo and bronchomalacias. You may be wondering why I've chosen to talk to you today about this topic. This is the most misunderstood medical diagnosis that causes respiratory distress in infants. 1 in 300 babies are affected by laryngo, broncho, and tracheomalacia, with 5% needing surgical intervention annually. Today, we are going to discuss what laryngo, broncho, and tracheomalacias are, as well as the signs and symptoms to look out for, so you can identify this not only in your own child, but children that you may be around in your everyday life. Laryngomalacia is defined as the softening of the epiglottis above the larynx. The softening of the epiglottis causes it to fall in with each breath that the child takes. It is most commonly presented with stridor. Bronchomalacia affects the bronchial stems of the lungs. The bronchial rings have a softening which causes them to fall in with each breath took, a lot like laryngomalacia. However, bronchomalacia differs from laryngomalacia because it only presents itself when the child is sick or when a flexible bronchoscopy is performed on the child during anesthesia. Tracheomalacia is where the rings in the tracheal are too soft and fall in with each breath. Tracheomalacia is one of the most prominent and easy to identify because it is most commonly called a narrowing of the airway. The signs and symptoms that we are going to talk about today can present differently in every child due to the severity of the airway defect that they may have. If your child presents with one or more of these, please talk to your pediatrician about the concerns to make sure that your child does not have one of these airway defects. The first sign and symptom that we are going to talk about is stridor. Stridor can be defined as a wheezing or barking sound that a child makes when they breathe. This can be seen when the child is agitated or when the child is sleeping. The next thing we're going to talk about is feeding difficulties. Within feeding difficulties, we're going to talk about choking, aspiration and reflux, and poor weight gain. Choking can seem as if the flow of the bottle nipple or the consistency of baby food is too much for your child. However, this may not be the case. Many children have difficulty swallowing when they have an airway defect because of the floppiness within the affected part of the body. Reflux and aspiration are the most common signs of difficulty feeding. Reflux and aspiration can be silent or prevalent. Even with silent aspiration, you can still tell in your child because they will get redness around the eyes and watering. It can present with howling, back arching, and refusal to eat. The third and hardest effect of feeding difficulties is poor weight gain. Poor weight gain can cause a child to become failure to thrive. Failure to thrive is when the child falls below the 50% benchmark of other kids compared to their age. This is my daughter at 4 months old, the size of an average 2-year-old. She was failure to thrive until 7 months old. The next sign and symptom we are going to talk about is cyanosis. Cyanosis is blowing due to lack of oxygen in the body. This can happen around the mouth, on the lips, in the hands and the feet. The hands and the feet are the most common for cyanosis to happen in regularly. Although the hands and feet may have cyanosis, that does not mean that the child has lack of oxygen to keep their body regulated. This is what cyanosis in the feet looks like. Cyanosis in the feet can last for several minutes, up to several hours. Always check your child's oxygen level if you were concerned because they have cyanosis in the hands and feet. The fourth and most life-threatening sign and symptom we are going to talk about is apnea. Apnea most of the time goes undetected because parents don't realize the short pauses their child will have in breathing. It generally happens when the child is sleeping. However, if you realize that your child has these pauses in their sleep, please call paramedics right away to have your child evaluated to make sure that there's nothing more going on. If the child was to go unconscious, please start performing CPR on your child. Now that we have talked about the signs and symptoms today, I want to take a minute to recap. All of these signs and symptoms can be prevalent from birth. I realized my daughter's just 48 hours after birth. The earlier that these signs and symptoms are caught in children and they get the diagnosis, the less time they're going to stay in hospitals, the more they're going to have available for better treatment and a better quality of life. Although these 3 words can be scary, especially to a brand new parent, they're long, convoluting, hard words. There's a lot that goes into the treatment for them. Never give up hope, because my daughter went from a failure to thrive to a happy, healthy toddler after surgical intervention.